Thank you for joining us today. Please bring welcome to our participants.
Thank you for that warm welcome. Good morning, everyone. As stated, my name is Amy Fowler. I'm a pediatrician at Chapel Hill Children's Clinic, where I've been swabbing noses for COVID since March of last year. I also currently serve as an Orange County Commissioner. I appreciate the Chamber inviting me to make a few welcoming comments on this very important topic. COVID-19 is one of the most penetrating problems that we as a community, state, and nation have experienced and are still working diligently to solve. COVID-19 has led to more than 500,000 deaths in the United States, and my heart goes out to those of you who have lost a loved one, and others have endured severe illnesses and lengthy recovery periods. These are real people's lives, and far and away the most important reason we need to solve COVID-19. Thankfully, most of us have not actually contracted SARS-CoV-2, yet the pandemic has impacted every aspect of our lives, from our physical and mental health to education, to our economy, and how we function together as a society. We have done our best to try to adapt. We have learned to conduct patient visits, business and government meetings, and even hold class via video conference. Online shopping and food and grocery delivery services have burgeoned. Yet, despite our ingenuity, many challenges remain. It is really difficult to foster relationships, celebrate milestones, run a local business, educate our youth, or enjoy a concert or play via the internet. For all these reasons, we must solve COVID-19. I am hopeful with COVID-19 vaccines in the midst of distribution that we will soon be on the road to recovery. Meanwhile, please continue to wear a mask, wait 6 feet apart, and wash your hands. Did I mention I also studied preventive medicine? Thanks again to the Chamber for holding this important forum. Thanks to those of you who are tuning in for being engaged. And thanks to the local experts who are taking the time to bring us all up to speed on where we stand at present as it relates to COVID-19 and what long-range planning is necessary and in process to revive our community as we emerge and recover from the pandemic. I wish you all a productive meeting, and everyone stay well.
Thank you, Commissioner Fowler. Now it is my pleasure to recognize our sponsors whose support makes today's forum and the entire 2021 Critical Issues series possible. First, Chapel Hill Media Group, including 97.9 The Hill and chapelboro.com. 97.9 The Hill WCHL is your local radio station and Chapel Hill's oldest, most reliable broadcaster. The station, found on FM 97.9 and AM 1360, features excellent programming for the greater Chapel Hill Carrboro region, including local news, sports, and talk shows, as well as alternative music and CBS reports. You can find all that and more on chapelboro.com, your daily local news source. Today, we're delighted to have Chapel Hill Media Group General Manager and former Chamber staffer, Aubrey Williams. Aubrey, please bring welcome to our participants.
Thank you, Katie. Good morning. Chapel Hill Media Group is super excited to be a presenting sponsor of the Chamber's 2021 Critical Issues series. I invite you to tune in to 97.9 The Hill at 4:30 p.m. today to hear Chamber's Aaron Nelson share the top takeaways from the discussion this morning. And then check out chapelboro.com for Katie Lewis's article, which will share some additional key insights. A few updates from Chapel Hill Media Group. In January, we launched 2 new programs, This Morning with Aaron Keck from 6 to 9 a.m. and News on the Hill with Brighton McConnell from 3 p.m. to 6 p.m. Both are Monday through Friday and can be heard on the radio or streamed from your smart device. If you're looking for hyperlocal news that is relevant to you, tune in or visit our digital newspaper, chapelboro.com. With that, I hope you enjoy the program. Back to you, Katie.
Thank you, Aubrey. Next up, Duke Energy. Did you know that Duke Energy is one of the largest energy holding companies in the United States? They provide power to nearly 10 million customers across half a dozen states. And they were named one of the world's most admired companies by Fortune magazine in 2020 and one of America's best employers by Forbes in 2019. They're building a smarter energy future, and we appreciate their support of these thoughtful forums. With us today to bring welcome is Duke Energy District Manager Indira Everett. Indira, always great to see you. Please bring welcome.
Thank you and good morning, Katie. Great to see you as well and all of your participants. Duke Energy is certainly proud to sponsor this series and especially today's topic on COVID. Duke Energy has a particular interest in making vaccines available as soon as possible, particularly for our field and frontline workers like our linemen. And we actually stood up a COVID task force last year, and we've been monitoring this closely, as well as how we're planning to get our employees back into the office. So today's topic is certainly of interest to me, and I look forward to learning more about the call. And as Katie mentioned, Duke Energy is proud to serve. We serve approximately 7.7 million customers in the Carolinas, Florida, Ohio, Kentucky, and Indiana, and retail natural gas services to more than 1.6 million customers in the Carolinas, Ohio, Kentucky, and Tennessee. So this topic is of concern to us because we serve such a broad service territory, and we look forward to hearing more. Thanks, Katie.
Thanks, Indira. And last but not least, Durham Tech. Durham Tech is the community college that serves our workforce needs here in Orange County. They have a beautiful 20-acre, 40,000 square foot campus centrally located in Orange County near Hillsborough. And they just recently secured funding from the Orange County Commissioners to begin planning for the expansion of that campus. With us today is the Durham Tech Chief of Staff, Tina Ruff. Tina, we're so glad to have you. Please spring welcome.
Good morning. On behalf of President J.B. Buxton and the entire Durham Tech community, welcome to today's forum. We are pleased to help sponsor the policy series and the important information they bring to our community. We are also excited about our work in Orange County. Current offerings at our Orange County campus in Hillsborough include, but are not limited to, various health-related, emergency medical science, and university transfer programs. Recently, we've expanded our instructional offerings to the Europa Center, in Chapel Hill. We're thankful for the commitment of the Orange County Commissioners to construct a second building, as Katie referenced, on our Orange County campus that will allow us to expand programs and services. We are working with the Chamber to hold a session with employers in Orange County to share and receive feedback on our priorities for the expansion. We are working hard to help put the region back to work and are continuing to offer short-term 6 to 8 week courses in occupations and sectors that are in the growth mode, such as IT, biowork, healthcare, and logistics. Thank you for what you're doing to employ residents in Orange County and beyond, and we look forward to partnering with you to power the recovery. Enjoy the forum and continue to take great care.
Thank you, Tina and Durham Tech. All right, now on to the program. As I mentioned before, the Chamber President and CEO, Aaron Nelson, will moderate our discussion today. He's got a tall task because I have packed 10 pounds of fun in a 5-pound bag. So Aaron's going to keep it snappy. As you know, he's led our Chamber for 20 years. He's a Carolina grad, and he's always quick with a joke or an insightful comment. Aaron, take it away.
See if I can whip up a joke or an insightful comment. Thanks, Katie. We're so glad to have all of y'all with us today, and we are going to move into really an exceptional program. So we're going to break this down into 2 segments. Segment 1 is going to be what employers need to know right now with regard to vaccines, testing, business operations, employment law. Many of you have asked the question, can you require your employees to have a vaccine, for example? We're going to get to that question. Segment 2 is going to be what do employers need to know about the path ahead as it relates to long-term recovery and business continuity planning. So let's get right to it. We have 4 great speakers for segment 1. I'll bring them up one at a time. They're going to give a quick presentation, 5 to 8 minutes or so. We'll have discussion and questions with that speaker, and then we will move on to the next one. I'll apologize in advance if I need to sort of cut anybody off or hurry them along. If you do have questions, please drop them in the chat. We'll be keeping up with that there. And if you have the answer to somebody's question, you can welcome to put that in the chat as well. First up is going to be Orange County Health Director Quintana Stewart. We're so grateful that in her very busy schedule right now, she's able to be with us. Prior to the pandemic, Director Stewart already had a full plate, as many of you all know. The health department oversees clinics, environmental health services, nutrition, family planning, maternal health, refugee health, and then communicable diseases to our residents. And she has been leading our COVID-19 response to this pandemic, still with a smile on her face 1 year later. We are grateful for her partnership, and we're pleased to honor her with the Duke Energy Citizenship and Service Award at the Chamber's annual meeting most recently. Director Stewart, we're very glad to have you. Will you please let us know what's the state of play here in Orange County, and what do you think employers need to know right now in order to continue to be successful in this pandemic?
Well, good morning. Thank you for having me. And it has been quite the ride this last year, I will say. So I'll just jump right in because time is of the essence and I want to keep it crisp. So next slide. Yep. So we'll start out, set the tone for the day, just letting you know what is the status of COVID-19 here in Orange County. So as of yesterday, we have a total of 7,623 lab confirmed cases. To put that into perspective, over the last 7 days, we've had about 150 new cases. This is good. This is a significant improvement from where we were a couple of weeks ago. So we're averaging roughly around 21 new cases each day. Unfortunately, we've also had a total of 93 total COVID-related deaths here in the county since the pandemic started. If you're keeping up and you're watching the Department of Health and Human Services and that county alert system, for the longest time on the map, that is in red, orange, and yellow, that defines your tier and which tier you fall in relative to the spread of COVID in your community. For a long time, Orange County, we stood out right in the middle of the map and we were yellow. At this time, and for the last couple of reports, we are in orange. We're tier orange, which means we still have substantial community spread here in Orange County. So numbers are getting better. We're going in the right direction, but they're still really high. Next slide. So yesterday, Governor Cooper had a pretty big announcement easing some of the COVID-19 restrictions. So I felt it was imperative that I just mention this briefly this morning. So effective this Friday, February 26th at 5 p.m., he now is going to lift a modified stay-at-home order. So the curfew is what we used to call it. So folks are now allowed to stay out beyond 10 p.m. and you can come out before 5 a.m. The mandatory mask mandate will not change, so folks will still need to continue to wear that mask. The indoor mass gathering number has increased, so we went from 10 to now 25. The outdoor gathering limit remains at 50. The curfew on sale of alcohol for on-site consumption has gone from 9 p.m. to now 11 p.m. And then there are some new occupancy restrictions. Again, I won't spend time on this form unpacking all of it, but I did include a link to the full executive order for folks to review later. But some good news is there for our businesses. 2 occupancy restrictions, 30% and 50%. So we have several folks that will now be able to expand a bit. If we were at 30%, but you had that 100 cap, now you can go up to 250. And then we have several businesses that will be allowed to come online at 50% capacity. Next slide. So as you increase your capacity and or reopen, safety protocols are a must. So again, those 3 W's that Dr. Fowler mentioned earlier in her welcome, don't forget, we got to continue to wear the mask, wait the distance, and frequently wash and clean our hands. Use hand sanitizer whenever there is no soap and water available. It's important to continue to clean, disinfect, frequently touch surfaces daily. And then most importantly, please stay home when you're sick and encourage employees to stay home when they are sick. So right now, vaccine, this is the topic of the day. Folks that we are currently vaccinating are those that fall in group 1. So that's our healthcare workers, long-term care staff and residents, and also those that do regular care for medically fragile children and adults. We're at our older adults, age 65 and up. And then as of yesterday, we are now open to vaccinating childcare workers and teachers and staff in the K-12 school system. So that's where we are right now as of today with who is eligible for vaccine. You can go to the next slide. Beginning March 10th, so right around the corner, we'll move into phase 3, the full group. And this is where we are able to vaccinate our frontline essential workers. CDC defines our essential workers as those who are in sectors that are just a must and essential in order to keep our society up and functioning. To meet this criteria, you must be in a role that requires you to be in person at your workplace. So this is not intended for those that have the ability to work from home. This is for folks that have to present and they are public facing. So frontline essential workers, you must fall into one of the 8 essential sectors listed below. So that's our public safety, critical manufacturing, education, and that will include college and university folks as well. Essential goods, meaning that you sell groceries and medicine, food and agriculture, government and community services, healthcare and public health, and transportation. I also included a link here that will take you to a deeper dive document that clearly goes into more detail about each of these 8 essential sectors. So process to get vaccinated. I will be completely honest with you. Orange County Health Department, we are still planning, but we will be ready for everyone beginning March 10th. Right now, some of our preliminary plans, and we're going to start doing some testing of this sometime next week, but we want to send out a team of volunteers to visit our essential businesses to provide the education and help folks complete the vaccine interest survey, which ultimately gets you on the list and ready for an appointment. Our goal is minimum disruption of the workday. So as much as we can, we want to come out to the businesses to help get the vaccination process completed. So while you wait for your shot, I just don't want folks to forget, it is important to continue to test. We have 2 testing sites that are open Monday through Friday each week. We have a site in Hillsborough, right across from the main health department campus there with it. And then we also have a site in Chapel Hill on MLK, the R7 lot. So it is so important that folks continue to get tested if they have been exposed to someone with COVID-19 or they are experiencing symptoms. And again, even after you get your vaccination, the 3 W's are still important. We will still need to wear the mask, wait 6 feet, and wash our hands often. This is our best protection for slowing the spread of COVID-19 in our community. So even after you get vaccinated, even after you've had your 2nd dose, it's been about 14 days and you're fully vaccinated with all the protection that vaccine has to offer, we will still need folks to practice the 3 W's. And that's all I have. I was trying to make time because I did not want Aaron to have to pull me.
There was a question in the chat, and the question was, if one guide says you're at 30% capacity and another one says you can do 50 people, which would govern?
So the capacity is your fire capacity thing. So that's the number they're using for that capacity number. I have to know more detail about what the limitations are, because that's based on square footage and yeah.
So, and as I understand from the fire marshal who is doing those, if for example it says that you may have 50 people inside, but your emergency fire limit set at 30% means you can only have 25 people, then you can only have 25 people.
Correct.
You'll be restricted to the one that is most restrictive.
Yep, that is correct.
Are there other questions that folks have for Quintana or that folks came across in the chat? And we're going to move to vaccination here in a moment, and we're going to move to testing right after that. What questions do folks have for Quintana? Katie or Vanessa, did you see any come through?
That was the only question, I believe. It was really honing in on what do music venues and bars in particular need to know on this occupancy cap versus the 50 person gathering.
Right.
The bars will reopen in just a minute, right? Friday at 5, they've been open, but they've not allowed any indoor dining. It still will be at 30% of their, it's called emergency occupancy.
Mm-hmm.
Quintana, folks can visit your website and they see, for example, that you got 500 vaccines this week and you have 10,000 people in line queued up. But that isn't, the Orange County gets more, right? The hospital gets some, and I guess we'll move to Dr. Wall on some of these in a minute, but.
That's correct.
Are you encouraging people to just stay in Orange County or to look across the state if they can?
So when you visit our website, thank you for bringing it up, Aaron. We list all the folks that we know have vaccine. We list our vaccine providers in Orange County and in our surrounding counties. So if it is feasible and folks are able to, go next door to another county because they have vaccine and an appointment, then it's okay. You can go. There's no barriers to county residents with vaccination. And you're right. What we have posted on our website is only telling you what we at Orange County Health Department receive. And so our base allocation for the next 3 weeks is 500 doses a week. We do have a really large wait list, but it's encouraging because that number is dropping, drastically each day. So as folks find open slots in vaccine, they're getting their vaccine, and then they're communicating with us and we can pull them off the list. We're only updating that particular infographic once a week just because I'm limited with staff and we're also trying to get the shots in the arms. But I'm encouraged. I think we'll get through our wait list sooner rather than later. It still take a couple of weeks, but I'm confident we're going to be able to supply vaccine to those that really want it.
Let me ask everybody, if you put yourself in a wait list somewhere and then you got an appointment somewhere else, please call back and let that other organization know to remove you. I think the health department, you all just were able to remove 8,000 people from your wait list because they had queued in your wait list, but they had found their shot somewhere else.
Correct. So it is so important. Please communicate and get off of those wait lists. Otherwise, we spend time and effort when we get the vaccine. We're calling you and we're trying to offer you an appointment, and we could have moved on and got with someone else. So yes, please let folks know when you need to come off a wait list.
Director Stewart, you have woken up every day. Well, you put a smile on your face when you interact with us and the public every day. There have probably been days in which you weren't so happy to leap at what was on your desk. We are so grateful for you. Thanks for staying with us in this program. Let's move to Dr. Wall and talk about vaccines. Luckily, we live in a community where you don't just have to read about the experts on vaccination. We have the experts on vaccination, and Dr. Wall is one of them. He's a professor of medicine in the Division of Infectious Diseases at UNC Chapel Hill and UNC Health, and he is the vice chair of the Active 2 trial. His incredible career, he spent a significant amount of time in Africa treating patients with HIV and Ebola. And it is that service in Africa where he learned and has become one of the leading experts on coronaviruses in the United States. He has helped lead the research that goes on at UNC on this. And as you probably know, UNC was a test site for the COVID-19 vaccine developed by Moderna. In addition to being an infectious disease specialist and researcher, he is the go-to spokesperson for UNC Health when it comes to explaining complicated things like this vaccine. So Dr. Wall, we're very grateful to have you here. What should employers know to share with their employees about vaccine and getting vaccinated?
Yeah, no, thank you, Aaron, for that very gracious opening. Quintana, Dr. Stewart had shown more up-to-date, hours updated slide about who's eligible. As you mentioned, Aaron, there are 2 vaccines that I think everyone is very familiar with, Moderna and Pfizer. They're highly effective at preventing COVID-19 disease, including severe disease, which is what I think we care most about. And as everyone knows, it's a 2-dose regimen, 3 weeks to 4 weeks apart. And about 2.1 million people in North Carolina have been vaccinated. About 7 to 8% have gotten a first dose, about 13% have completed. So that's good. And as Dr. Stewart mentioned, there's strides being made, but it shows that the vast majority of people in the state have not been immunized. Just going to go, yeah, so perfect. So there's some challenges, of course, in delivering vaccine, especially one that requires 2 doses. As folks know, Johnson & Johnson has a vaccine that doesn't require the cold storage that these vaccines do, and that is administered just once. And that's really promising. The FDA is looking at authorizing that tomorrow, and that will add a whole new element and supply, I think, of vaccination that will make things more plentiful. Because right now, we really had trouble. And as Dr. Stewart said, and I'm sure many of you are scratching your head, tens of thousands of people waiting for vaccine, more people who are now eligible, and 500 allocation a week. We consider ourselves somewhat fortunate at UNC Hospital in that we get 1,000 doses per week, but our Friday center basically on an average day can vaccinate 2,000 per day. So we all are getting too little vaccine. I think there's been other challenges. As many of you know, there's been some confusion and changes in who's eligible, who's not eligible. Why is someone who's 63 and has 2 comorbidities waiting behind someone who's 23 and working in a daycare? All these sorts of issues of equity and fairness. It's hard work, but I think that there's been a lot of confusion that I think is settling down. And the biggest problem has been the supply. And as you can see here, the weekly allocations from the North Carolina Department of Health and Human Services website shows that we haven't done such a great job of first dose vaccines over the last week or so. And that also has to do with the weather. There were delays in shipment, and also distributing the vaccine statewide. There's just a lot of mouths to feed. And I think when it gets spread thinly, everyone's a little bit hungry. There's also, again, like I said, many people who are eligible, who can't get the vaccine right now, but there's also people who I think are vulnerable, who just can't get the vaccine because their group just hasn't been called yet. Next slide. I am hopeful. I think that with the J&J vaccine and greater supply to the states, as we heard from the federal government over the last week or so of the Moderna and Pfizer vaccines, we'll have more options for people. Questions may come up about the relative efficacy of the Johnson & Johnson vaccine, and we can talk about that maybe in the chat. I think the Johnson & Johnson vaccine is fine. I think it works really well at preventing severe disease. It works even against the South African variant, which we'll talk about in a second. So I think that it's something that should be put out there. I think it's going to be useful. It's very hard to compare study to study. Populations are different. And I think this vaccine actually was stress tested in a way the Moderna and Pfizer vaccines weren't, given that it was used in sub-Saharan Africa. It was stress tested against some of the variants. And I think that may give it a little bit look of less efficacy, but I think its efficacy is on par with what we want and need to get out of this pandemic. And again, there's really good features of this, including only giving 1 dose and the cold chain. Let's talk a little bit about what I think for the business community we all have to be working towards, and that's community immunity. And this is a basic concept that I want to illustrate in the next few slides. So as we know, when you have a whole bunch of people here in blue who are healthy and they're not immunized, and then you have people who are immunized in yellow, all those blue healthy people are susceptible to infection from the people who are indicated in red. These are sick and contagious people. And so when you have sick and contagious people, even just a few, spreading it to 1 or 2 people, you can get propagation of an infection in a community. And that's illustrated here. And this is basically what we've been dealing with for the last year. Next slide. As you introduce more and more people who are immunized and feeling well, and hopefully cannot shed the virus. And another nice thing about the J&J vaccine is now we have some data from them that we don't really have so much from Pfizer and Moderna, showing that there is limited acquisition or virus getting into people's body for a prolonged period of time to provoke a response, meaning it may not only protect against disease, but it may protect people against propagated infection, getting infected and then shedding the virus, which is really important. When you have more of these people who are immunized, you really start to truncate the spread of the virus in the community. Next slide. And if you reach a critical mass of these people, you really do limit how many people are actually available in a community who are susceptible to the infection and could get sick. And if they do, they're very unlikely to transmit it to someone who's one of these people in blue who are still healthy and not immunized. Next slide. So it's hard to see this, but here's some modeling, and I could read it to you. At the current pace of about 1.5 to 2 million vaccinations a day in the United States, given the immunity that people have just because they've been infected, because a lot of folks have been infected in our country, right? So over 20 million. So those people may be very well immunized, if you will, or protected. When you add on top of that people who are vaccinated, we think we might get to that community protection or that community immunity threshold somewhere around probably July. And about 100,000 people, though, from now until then will likely die from COVID-19. If you increase the supply of vaccination so that those curves go up, and Dr. Stewart gets 2,000 doses a week and we get 5,000 doses a week, what we'll start to see is that threshold gets moved over to the left, where we start to see earlier community protection or community immunity, where maybe now we can save 10,000 lives. And if you go even further and really be aggressive, 5 million doses, now this is aspirational, but 5 million doses a day We may reach that threshold in April and save another 10,000 lives on top of that. So 20,000 people. So this is really important. The supply issue is not just a headache for people like Dr. Stewart and myself and others who run vaccine centers. It's a matter of life and death for our community. We need to do everything we can to support this and do it equitably. Next slide. What about variants? Variants are scary. Variants can change everything. And so we've seen really good, remarkable results lately from all the things we've been doing. The masking, the distancing, the mitigation strategies that have been put in place, even though they're painful and cause a lot of misery, I understand economically. Mutations in the viruses can change this. Viruses mutate all the time. There are three mutated viruses we're really keeping an eye on, and you've heard about these because of their geographic origin. So the UK variant, it's more infectious. The vaccines protect against it, so that's good news. The South African variant's the scary one, and you can see in the map here pulled yesterday from the CDC site, we are seeing the South African variant in the country, including here in North Carolina, and especially in South Carolina. Now, part of this is you have to sequence viruses to find out if it's there. You have to look for it. And we're not looking very, very hard, although that's improving. The state's doing a better job. We're doing sequencing every day now to see if this is there, because what you don't know about can hurt you. That South African variant, as we talked about, could have reduced protection from some of the vaccines. So that's a major important point. Also, some of our therapeutics don't work as well against the South African variant. There's a similar variant from Brazil, hasn't been spreading very much lately, but that's another thing to keep our eye on. Next slide. Again, good news is things are heading in the right direction. I'm hopeful that the governor's announcement yesterday will not conspire with maybe more infectious virus being passing around to reverse these trends. So I'm cautious. I'm scared and worried about it, but I understand the motivation for it. But those of us who see people die every day from COVID-19 are really hesitant to pull back too quickly, too fast. We've seen this in other countries, and they've had peaks and valleys and then higher peaks. So good news, we're doing great across the system. UNC Hospital is seeing real decline in admissions, including to the ICU, so that's fantastic. Next slide. And our projections, and some of you have seen these before, UNC Health does a lot of modeling. We're hopeful that if we could keep on the track we are right now, we can start to see really negligible COVID admissions come April, May, June. And that's what we're keeping, next slide, our fingers crossed to make happen. But it's going to take us all working together. If we open up too quickly, too fast, I think we're just going to trade one misery for another type of misery. I'll stop there and take any questions, Aaron.
Dr. Wall, that is super helpful. Let's go back quickly to Johnson & Johnson. I'm imagining some folks will show up to get a vaccine and that you don't get a choice. You'll get the one they stick in your arm, right? And so there's been some anxiety about it, but I saw some data, and you probably know it more specifically. It's 85%, whatever, it's 70 whatever percent effective of you not getting it, but 85% effective you not going to the hospital, and 100% effective of you not dying.
Right.
Can you say some things about why folks should not be concerned about which one they get? Would you be concerned about which one you got?
Yeah, no, it's a really good question. I think we're going to have to do a lot more education and messaging, because even right now, people come into our clinics asking for Moderna or Pfizer, which are essentially like I understand why. My dad only drinks Coca-Cola. He will never drink Pepsi. Like, forget it. You couldn't pay him to drink Pepsi. Of course, they're basically the same thing. So I understand that there's some Coke and Pepsi sort of preferences, but they're basically the same sugared brown caramel colored water. Okay. Johnson & Johnson's a little bit different. I get it. And I think there's advantages to the Johnson & Johnson. And I don't think that we can look at the studies and say that it doesn't work as well as. It works really well at preventing people from dying. No one who got the vaccine died of COVID-19. So that's really, really important. It's very effective at preventing severe disease, which is also what we want. Statistically, the difference between an 86% and a 93% or even a 95%, there's a lot of overlap there. And we're not playing on the same playing field. They studied this later than some of the other studies were done. They studied it in Latin America and South Africa. I think this is a very effective vaccine. And we got some data from the FDA just yesterday that showed it's even better than what we thought a week ago, including against the South African variant. So I would take the Johnson & Johnson vaccine. My daughter's a childcare worker. When her time comes, if the J&J vaccine is offered to her, I will encourage her to take it.
Regarding vaccine, I like your analogies. We have Coke, Pepsi, and maybe RC Cola, which is really
RC Cola,
fabulous cola.
which is
It really
fantastic,
is. Give it a
right.
chance. It is probably better than the others. When vaccine comes, so the health department has some. You guys at the hospital are doing it at the Friday Center and all throughout your network. Folks can call the Friday Center. Well, they can call. There's a phone
Don't call the
number and
Friday
website.
Yeah, so Hillsborough Hospital and Friday Center are where we're giving vaccines for UNC Health in Orange County. We want to work, and we do work really closely with the Orange County Health Department. They're doing a fantastic job in any ways we can help. We're trying to figure out more ways we can work together. Really powerful allies. There's yourshot.org. Google it. When we get more vaccine, we open up appointments. We do not want to book for the next month and then something happens like it did last week with weather. We never want to be in a situation where someone shows up and we say, sorry, we're out of vaccine, or have to call and cancel your appointment and not be able to reschedule you. Other health systems have had to call thousands of people to tell them not to show up when they did not get the vaccine supply that they thought they were getting. So it's almost like the gold standard. Remember, every dollar was backed up by some gold, at Fort, Worth or something. So, Fort Knox, so this is our gold standard. When we get vaccine, we open up slots. And the more vaccine we get, the more slots we open. So be patient. I know it's hard, but yourshot.org, and then you're online. And if you're eligible and you're in the right group, you can get an appointment to get a vaccine at one of our centers.
Perfect. We will send out the slide deck as well as those links afterwards to folks. Some of you may have even posted them into the chat. Dr. Wall, we're very grateful that you are with us today. If you have we know that you may need to jump off and get to the rest of your day. I'm sure other presentations, but we're grateful for your time.
Thank you, sir.
Thank you. Let me pivot to Dr. Roy. Dr. Roy earned his doctor in pharmacy at UNC Chapel Hill and has 20 years of experience in diverse healthcare, a diverse healthcare experience. He was in commercial biopharmaceutical industry, novel drug development, market access, direct patient care, and he is the co-founder of Indie Healthcare. You may be familiar with their facilities. There's one in Hillsborough, there's one in Northern Chatham. Both a pharmacy and direct care provision. And what we have asked him to come and talk a little bit about is he has been the person that I have really engaged when I have curious questions about everything from testing to group testing to pooled testing. Dr. Roy, will you talk to us a little bit about your practice, what you guys are up to, and what you're seeing happening and changing regarding testing in particular? Welcome.
Yes, thank you, Aaron. And I'm going to fly here, but I put my email address up there, so please do contact me directly after this if you have any questions at all. And I'll try to piggyback off the great information from Quintana and Dr. Wall. So we at IndyCare, we do a number of things. We have a couple pharmacies, we have a clinic, we do urgent care, we work with a lot of employers on employer health, occupational medicine. And during COVID, we focused a lot working with employers on COVID-19 workplace safety. So I just want to quickly give you a snapshot of kind of where we've been, where we are now, and perhaps where we're going. So if I look back at the past and I think about the first few months of the pandemic, I call that the scramble, right? There was very limited PPE, limited testing. The symptoms as an employer that you were supposed to be monitoring kept growing and evolving. There was a lot of inconsistency in the medical advice being given to people. And overall, it probably felt like a lot of disruption in the workplace. I think where we're at now, and probably have been for the last 6 to 8 months, is more of what I call the routine, where PPE and masks and testing are available. Most companies have some structure around the way they monitor temperatures and symptoms. There's things that have kind of come onto the market that are really helpful, like air filtration systems. And in some companies have even gone further and kind of developed formal partnerships to handle their testing needs and things like that for their employees. And even are doing surveillance testing, which I'll elaborate more on in a minute. In terms of where we're going, I'm calling that the protected state, right? And this is where we're going to have things like your employees are going to be vaccinated. From a testing standpoint, if you look at the technology that's being developed and invested for testing, it's all about cheap, accurate tests that people can do at home. So you can do that before you go to work, before you go to school, before you go to an event, get a result and sort of be cleared. And I think the combination of those things will lead to these clear pass style systems where, if someone's got something on their phone, they've been vaccinated or they've been tested negative, and they gain access, whether that be to a school, to a workplace, to an event, et cetera. And so we're moving from very reactive sort of strategies in the beginning of this to very, very proactive things as we currently are and move forward. So when we work with companies and try to explain what maybe an ideal workplace safety plan is, the goal is always to keep your employees safe while maintaining your operations. And there's really 4 things that we kind of look at and discuss with employers to do that. It's your temperature checks and symptom checks. We try to encourage people to do that remotely. And there are some really affordable tools and apps and things that can help you as an employer to do that. It's much better to have people check those things at home before they leave, before they come in. In addition, we look at your sanitation, air purification, PPE use, distancing. I think most people are aware of this now, but sometimes this can be hard to control. Employees drive to work together, leave in the same car, go to lunch. So there's vulnerabilities there, no matter how good you're trying as an employer. The other thing we do and recommend a lot is surveillance testing. And I'm going to elaborate on that in the next slide, but this is just regular testing of your employees to identify infected people and isolate them before they can spread it. So employee surveillance testing, what is it as an employer, and what am I talking about? It's pretty simple. It's regular testing of your employees who are not having symptoms, but testing them for COVID. And why would you do it? There's really a singular reason, and that is to prevent asymptomatic spread of the virus at your workplace. And you do that because we know up to 40% of cases are asymptomatic. Individuals are most contagious usually 1 or 2 days before they start showing symptoms. And the tests that we have can detect the virus several days before someone has symptoms. What have some of the results of surveillance testing been? Most of the data and experience comes from university systems. At the end of last year, there was some reporting and data about universities that did surveillance testing having up to 10 times lower infection rates than those that did reactive. And some of the most prominent experience with this has come from our backyard, looking at what UNC and what Duke did. And as a Tar Heel, it's kind of painful to go through this example, but I think we learn a lot from it. And UNC opened their campus in August with a reactive testing program, if you have symptoms or if you've had an exposure. And they had 670 cases in the first 2 weeks on campus. Duke, on the other hand, opened with a surveillance testing. I think they test twice a week on the students. And they had 84 cases in the first 10 weeks, and about half of those were asymptomatic. So when you do surveillance, you're catching people who don't have symptoms yet have the virus, and you're isolating them. I can tell you from our experience, the employers that we work with where we do this, that it's worked exceptionally well. And the way we measure that is when they do the surveillance testing and they have a positive case, and we test that entire workforce again the following week, the whole workforce has tested negative, meaning they're not spreading those cases at work. So you may ask, why doesn't everyone just do this? And the big reason is cost. The average cost of an individual COVID test is about $120 to $150. Insurance won't pay for this when you're doing surveillance. And so to test your whole workforce, that gets exceptionally expensive. So a really nifty solution to that that we do, some labs have developed protocols where they do what's called pool testing. And that's exactly what it sounds like. You put your employees into groups or pools. They each give that saliva specimen individually each week. Those are grouped together with the rest of the specimens from their pool, sent off to the lab. The lab combines them together and runs a single test on the group. They report the data out. If everything's negative, you go on your way and you do it again the following week. If you have a group that tests positive, you quickly isolate that group of people, individually test them to identify who contributed to the test. That person then goes into your normal quarantine treatment and return to work protocol, and everybody else comes back. So this is a way to do surveillance testing, significantly drop the cost of it, but still get the benefit of preventing asymptomatic spread of the workplace. The last thing I'll talk about are vaccinations. As an employer, you're probably thinking about, how do I help my employees get vaccinated? And there's really two strategies. There's a community-based strategy where your employees seek out vaccination through community-based providers. As an employer, you can help them by helping them identify those providers, giving them links to sign up and join wait lists and things like that. Another strategy that you may combine with that are employer-based, where you're going to partner with a vaccine provider to set up and host either an on-site or an off-site vaccination event to get your employees vaccinated. Strategy one is going to happen with or without you. People are going to seek out vaccines no matter what. Strategy two is something you can do to help kind of close that gap, because it is, as you know, difficult still to get vaccinated in the community. If you go to my last slide, and something, if you're thinking about doing that as an employer, it's helpful to know who's vaccinating. I think we're all aware of the phases of patients that are eligible to be vaccinated. I think what people are much less aware of is the phases of providers that are eligible to vaccinate people. So currently in North Carolina, we're in the first two phases of the rollout of vaccinators, meaning it's health systems, health departments, hospitals, federally qualified health centers, and sort of prisons and max vaccinating events. We soon, I believe, are going to move into the next phase where it's going to open up to independent primary care practices, local health department partners, and then the phase after that will include pharmacies and occupational health. So as an employer, I think the opportunity to partner with a vaccine provider to set up an event and do that for your employees will become more prominent soon as we turn on these other phases and more businesses are able to work with you. We just got our first shipment of vaccine yesterday, and we have our first employer event, vaccinating event set up for this Saturday. So I think more places like us will eventually get turned on. We're going to work through the chamber and get employers who are interested signed up to have these kind of events. And I know the health department, as Quintana mentioned, is also doing the same. So with that, I'll take any questions.
What I think Dr. Roy points out is to remind everybody there's multiple pathways to this solution. So there's lots of paths. You can sign up with UNC hospitals. You can express your interest with the health department and get in their queue. You can send Dr. Roy a list of all of your employees, and he can upload them into the CVMS system, and he can work with you that when he gets vaccine to set an event where he comes and vaccinates your employees. And so just knowing that there's lots of doors in front of you, and we're sorry it's not super easy and there's not one path, but paying attention as an employer to multiple paths is important. Kristen Young posted in the chat a reminder. Dr. Roy's example was about the first time UNC opened. This past semester, they are doing surveillance testing. Every student is being tested twice a week. And hey, y'all, if you don't follow this sort of stuff, it's pretty remarkable. They've done 70,000 tests and less than 0.5% positivity. Since February 1, they've done 39,000 tests with less than 2% 0.2% positivity. So the surveillance testing is working. Please do reach out to Dr. Roy if you want to talk about pooled testing for your employees as an inexpensive solution and a convenient way to do it. Quintana, if she had unmuted herself, might remind you that Dr. Roy is right. If you did pay for them, they'd be $110 a piece. You also can do the health department's drive-ups, put your nose out the window test system, and that one is still free and as frequent as once a week. I believe you can go if you wish. But you also have convenient providers like Dr. Roy. What questions do folks have for Dr. Roy? I really appreciate y'all are posting your questions, and then you are posting answers to each other's questions. Thank you, Vanessa, for posting Dr. Roy's email address. And then you have a website now where folks can engage with you both about pooled testing, employee testing, and then employee vaccination events. What's the best site to send them for that?
Sorry, what, can you repeat that?
What is your site if they wanted to engage with you about pooled testing or about?
You can go to indycarehealth.com/back, BACK, to work. And there you can register interest in having a vaccination event. You can also see some of the employer-based COVID workplace safety solutions that we offer. And you can contact us about different things you might be interested in.
Thank you, Dr. Roy. I appreciate how these things are building on each other. The health department, then broadly about vaccine, Dr. Roy talking about employer-based systems. And now let's move to an attorney. Many of you have had these questions. Can I require my employees to be tested? What role can I or should I play as an employer with respect to positive people? Can I prohibit them from coming to work? Can I keep someone out of the place of employment if they have a fever? So we have Ms. Jessie Thaler Moran with Brooks Pierce. She has focused her practice on employment law and litigation, counseling employers on compliance with state and federal laws. She helps companies plan for and respond to issues involving their workforce. She's advised companies on wage and hour issues, ADA compliance, Title VII, other discrimination clauses. She's the right person to have with us today. Most recently, she's been devoting a lot of her time to helping clients with appropriate responses to COVID-19, including new federal paid leave laws, which many of you all have had questions about, and then issues about staffing made necessary by stay-at-home orders. Ms. Thaler Moran, welcome. I hope I've pronounced your last name. We've not met. I've never heard you say your name. If you would introduce yourself to us, and we're glad to have you.
Hey, good morning. And you got it, you nailed it. So congratulations. It's rare to do that well with a hyphenated last name on the first try. I was thinking as some of the prior speakers were working through their presentations, it's interesting the combined perspective of the four of us on this first panel. We've all been spending the past year helping with risk management and counseling members of our community and clients on how best to do that in this brave new territory that none of us have ever experienced before. And obviously my approach is going to be a little bit different from the others in that I don't have any kind of healthcare or science expertise, but I do spend a lot of time looking at the ways that employers get themselves in trouble with government agencies and in courts and those kinds of things. And so my perspective is going to be in large part, while the underlying information will come from places like the CDC and the Department of Health and Human Services, my perspective is all, how do you limit legal risk to yourself as an employer? And there's, true to lawyer form, there's my lawyer disclaimer. This is for general information purposes only. A lot of the things that I'll talk about today and that have come up already in this presentation end up being very fact-specific analyses for employers, depending on what an employee needs, what communications they're having with their supervisor about health issues, those kinds of things. So this is a general backdrop, but please do not take what I'm saying in today's presentation as a definitive answer. If you have any question about something that falls in the gray area, I'm happy to talk with you out of this presentation, or if you have counsel you work with that's not Brooks Pierce, that's wonderful too. So I'm going to do my best to cram what I can usually wax poetic about for about an hour into about 5 minutes. Address COVID accommodations in the workplace under the Americans with Disabilities Act, which many of you are probably already familiar with. Vaccines, which everybody is very excited about, obviously, which have their own accommodation issues, and then just reiterate some general COVID-19 workplace safety concerns. So if you're probably sick of hearing this, if you are an employer and you've been following along with COVID precautions for the past year or so, but if you are large enough to be covered by the ADA, which that's 15 employees or more, an employee could have legal protections in the workplace for COVID-related reasons. And that could include anything from an underlying health condition to their recovery period from COVID taking longer than the standard 14 days. So if you have someone who's approached you with COVID-related concerns, and they don't have to use any magical language to do that, but if they've approached you, that little red flag should go up to consider possible ADA ramifications. A great resource to start with is this link I've put here from the EEOC. The EEOC has a great consolidated frequently asked questions resource on these topics. And it's important to note that the website's information applies to employers during the pandemic. And as we see what we're hoping to see over the next 6 months, as things start to subside a little bit, hopefully, all the fingers crossed, and we move into a little bit lower risk period, we may see that guidance changing. So it's great to, bookmark that thing on your browser to check periodically, because they have been updating it regularly. So some things the EEOC addresses, right now, generally employers' ability to request medical information from employees is very limited. In this situation we're currently under, a lot of those things have been given a lot more flexibility. So temperature screenings, I know at least one prior presenter has addressed, currently allowed. Antibody testing is not reliable enough in the EEOC's perspective to require those. We do encourage employers to work with their health department if they have an employee who tests positive for contact tracing purposes. Well-intentioned employers who are making decisions for employees who are pregnant or older or have something else that the employer perceives to place them at a higher risk. Employers are encouraged to work with employees if employees have made known medical concerns, but you don't get to unilaterally say, okay, you're pregnant and you're over 65, so you have to stay home. There needs to be an interactive process between the employer and the employee. Remote work, we've all become experts at by now. I almost don't even need that bullet on here anymore, but if there's a question about someone wanting to continue to work from home, that becomes a very fact-specific analysis about whether they have legal protection to do that. And same with higher risk family members. And just like every other government agency, and just like probably every other speaker that's come before me in this presentation, we've been encouraging employers to the extent they can to really work with employees to accommodate these new challenges that people are having, because in the long run, it's about making sure that we're managing risk and keeping employees as safe and as content as we can. Move on to the next slide and talk about vaccines. So I've heard that this is the hot button issue of the morning. Can you mandate that your employees receive the vaccine? And here's your typical lawyer answer. Yes, sort of. What do I mean by that? Well, they're subject to specific state laws. If you've got employees in a particular state, you want to make sure you're up to speed on their local requirements. The vaccine itself doesn't fall into that medical examination that triggers higher scrutiny by the EEOC and related agencies. But the pre-screening questions to determine if someone is eligible to get that vaccine might constitute a medical inquiry. So if you're administering the clinic yourself as the employer, or if you've brought someone on site who's acting as your agent to administer that vaccine, you're going to have some of those same medical inquiry concerns under the ADA that you ordinarily would. And so you really want to be diligent about making sure, to the extent information is being collected, it's necessary for business purposes, it's being safeguarded in a place that's away from personnel files. And again, that's anything other than vaccine up or down. If you're asking questions about their medical history or anything like that, that starts to veer into that collection of medical information territory. Oh, I'm sorry, I'm talking too long. The other point I was just going to make is if someone declines to get the vaccine, right now, the current guidance would say you may have grounds to remove them from the workplace on the basis that they pose a direct threat to their colleagues. But I expect that analysis will change, and there are exceptions to when someone has a legally protected right to decline that vaccine. So yeah, so be cautious, don't ask for any additional medical information in collection with that documentation, and do be prepared to work with employees who come forward with particularly a medical reason or a religious belief that precludes them from getting the vaccine. If you hear anything that potentially falls into those two buckets, that's your key that it's time to initiate what's called that interactive process under the ADA and determine whether the employee has a legally protected right to decline the vaccine, even though you've required it. And if so, what steps you can take to protect the employee and protect your workforce. Whether that means, continued PPE or remote work or something like that. The important thing will be to make sure that it is not punitive in nature, but really a response to what's actually a medical health concern in the workplace. Yeah, so again, the analysis is whether someone poses a direct threat. I'm glad these slides will be posted later because there's a lot of information packed into these. It's very hard to prove in normal times that someone poses a direct threat to the workplace. So I expect that as more folks get vaccinated and the threat drops, that we'll see that direct threat analysis shift a little bit. And then even if someone declines a vaccine, not for a medical reason or a religious reason, but just because they're not comfortable, I think I've seen statistics that something like 50% of that first wave of employees in North Carolina that were offered the vaccine turned it down. And there are all sorts of reasons that could go into that. And as the employer, you still have some practical considerations to weigh in terms of how you interact with that employee. NLRA activity is kind of your quintessential unionizing working conditions protection. So for example, if you have a group of employees who have come together and said, none of us are comfortable getting the vaccine, and you respond negatively to that, that could trigger some sort of NLRA protection. Questions about, if you're requiring them to go get the vaccine, I think they have a pretty good argument that they are entitled to be compensated for that time they're going to get the vaccine. And then in general, with all of these analyses, we have this OSHA requirement that employers do what they can to provide a safe workplace. And so that cuts both ways on the vaccine issue, right? You want to make sure that you are doing everything in your power as the employer to provide your employees with a safe workplace. And that's going to vary by what your working conditions look like in your workforce. So some alternatives, we've been encouraging employers to consider encouragement instead of mandating vaccines where it's possible. If you do a voluntary program, again, you want to be careful about collecting medical information. If you're offering incentives, some really neutral incentives would be like, paid time off to get the vaccine, or offering transportation to a clinic that employees could voluntarily take advantage of. But the important thing, if you're going to go beyond that, is it has to be a really minimal benefit. Like it, can't be half of your healthcare premium sponsored for the month. It has to be like a water bottle, a $5 Starbucks gift card. And those incentives would have to be equally available to those with legally protected reasons to not get the vaccine. So if someone's got a religious reason that they're not getting the vaccine, they need to have an alternative path to getting that Starbucks gift card if they choose to take advantage of it. And that might look like, I don't know, COVID safety training or something else, but those are just things to consider. And then like everyone else on this presentation has said, based on what we know now, we're really encouraging employers to continue that vigilance even after vaccination until we hear otherwise, right? So continuing with masking, distancing, other safety precautions. I know Governor Cooper's past few executive orders have encouraged employers to, or expected employers to make a good faith effort to provide a week's worth of masks to their employees. So if you're not already taking steps to do that, I would encourage you to make sure you're stocking up for the next several months at least while we sort of wait to see where the guidance will take us next. And then finally, the CDC and the State Department of Health and Human Services are updating their resources all the time on best practices. And we routinely talk with clients about, when in doubt, see what the latest guidance is from these expert public health bodies. So again, that, like the EEOC link, would be a great place to start if you have questions. And then if there are more specific details, I'm always happy to talk through something, or you can work with your own legal counsel if you prefer.
Jesse, thank you for that. It's a good reminder for everyone to go to the source, go to the CDC's website. If you instead just Google it, you're going to read an article from 4 weeks ago, and they're going to be giving you a brilliant analysis of a set of rules that don't apply anymore because they've changed. So be checking out, go directly to the source for the information, or check the date and time stamp on the article that you are reading. Any quick questions that came up in that chat before we move on? So the quick answer is, can you require your employees to get a vaccine? Yes. And if they object, then it's time to have a conversation. Is that, you got it? Works?
My lawyer brain would say the answer is it depends. But the quickest answer would be yes, but be prepared to work with employees.
Any other questions, Katie, that you saw come up in that chat?
No, I didn't see any.
Y'all, Brooks Pierce does an exceptional job of supporting local employers. Jesse has offered to make herself available for you to reach out to them, or to engage with your counsel if you have them. Many of you all, when people say call your attorney, you're like, I don't have an attorney. There are great local resources that can assist you with questions and advice like that. And if there's things that the chamber can do for you, help find that answer for you, let us know. Because we're moving so quickly through this, some of us are going to stay after. Our speakers do not need to unless they're able, but if any of you will want to hang out for a minute to get your question answered, like Brett Bushnell posted, should you test even if you've not been exposed? My thing is yes, test, because you don't know if you've been exposed. And so taking advantage of incredible resources in our community. So let's move on. Thank you, Jesse, to segment 2, deep breath. Now let's talk about going forward. It's been a year, y'all, since the stay-at-home orders were first issued, and we have invited our town manager. Many of you all know Maurice Jones. Maurice has a career in working with college communities before working in Chapel Hill, where he came in 2018. He was Charlottesville's city manager, and Dwight Bassett, also a substantial career working in our community and then throughout the Southeast as a really talented economic development professional. He worked for us, he worked for the city of Raleigh, worked for the city of Rock Hill. He's a master wood craftsman, also a former coffee shop owner, if you ever want to talk to him about that. We are glad to have the two of them to talk to us a little bit about where we are headed. So Dwight, Maurice, welcome.
Thank you, Aaron, and good morning, everyone. I'm honored to be with you here today to talk a little bit about the light at the end of that tunnel, that long, dark tunnel we've all been driving through during the course of the last year. This has been a devastating 12 months for our world, our country, and our community, and we've all lived in fear for the safety of our family, our friends, and our family, and our neighbors, and ourselves. How many of us have woken up in the middle of the night and you were convinced that you had COVID? I lost count on how many times that's happened to me. So there's been this fear that we've been living with during the last 12 months or so. And we've also lost way too many people to this pandemic, 500,000 deaths nationwide. We continue to grieve for them and their loved ones. And we've also, in addition to the folks we've lost a lot when it comes to our economy as well, in the form of jobs and businesses. And that economic security that many of us felt a year ago vanished seemingly overnight. So after all this suffering, we are thankfully seeing what was once a tiny little pinpoint of a light at the end of the tunnel become larger and larger as the number of COVID cases subside and the number of vaccinations increase. We are not out of the woods, as Dr. Stewart and Dr. Wohl stressed earlier, but there is indeed hope. And it's time for us to focus on reviving our economy. And I believe with the right planning, dedication, and investment, we can come out of this pandemic stronger than ever. So several months ago, the town organized our Revive Advisory Group to begin planning for our recovery after the pandemic. They have met on numerous occasions, first to pick the consulting firm, ultimately choosing Ernst & Young. They then reviewed the research and decided what our priorities should be on this road to recovery. We believe this is a diverse group of community members who brought a wide range of perspectives to the table, and they've really helped us understand the needs of this business community and their customers. A number of those folks are here today, and I want to thank them and all the folks in the advisory group for their good work thus far. So here are a few facts we've learned along the way, and I would imagine many of these themes are very familiar to most of you. One, the recession has had a disproportionate negative impact on populations of color and workers with lower levels of education and income as well. A number of small businesses, particularly those that are locally owned, have been devastated by the shutdowns, and some have struggled to adapt to the virtual business models that are out there. There have been significant layoffs that have occurred in service industries, with most impact being felt in retail, tourism, hospitality, and some healthcare. College towns have suffered uniquely due to campus closures, as we've experienced here, a shift to online learning, and of course, reduced student foot traffic. Remote work has led to a lower daytime population here in Chapel Hill, resulting in a sizable loss in revenue for our local businesses. And countless other changes have impacted the families, students, businesses, nonprofits, and government workers here in Chapel Hill. So here's a little bit of what we've heard from the group and our consultant so far. Chapel Hill, of course, has strengths in our incredible assets of UNC Chapel Hill and the health system here at UNC Health. Residents and business owners aspire to see a greater connectedness with the university by way of small business support programs for people of color. They are looking for ways to develop and incubate innovative ideas and companies. And they are searching for learning opportunities for all ages and backgrounds, and overall for a greater visibility of the university throughout the community. Our residents respect individualism, and they value the diversity of our community. They love the natural charm and feel of being a college town. The community wishes that our diversity and the talents of our residents are better showcased through our public art and events that drive traffic, especially in downtown Chapel Hill. And our town is also seeking to balance our economic growth with investments in the types of amenities that contribute to a high quality of life, like more green spaces and bike lanes. And there is a desire for the community to reduce its dependence on cars to get around. Growth can be a challenge for Chapel Hill. Residents facing housing issues are facing housing issues related to affordability and the lack of diverse offerings. Some workers and visitors struggle to access the community due to traffic and parking availability. Businesses, entrepreneurs, and developers often face challenges with permitting and the availability and cost of office space. And our leaders who've been working on the advisory group also felt that the talent pipeline and the development of great talent needs renewed focus here, and taking full advantage of the strength of our local school system, the presence of UNC and Durham Tech, and the overall emphasis on talent-driven economic prosperity. And new remote work trends are also offering new opportunities to recruit talent as well. So those are some of the findings so far. So what is our research telling us? First, I have to say there's a lot going on in this slide, probably a little too much, but it does give you a sense of our strengths and areas for improvement. We're going to touch on all of these. We're not going to touch on all of these points right now. There'll be plenty of time in the future to highlight them. All of these industries are important to Chapel Hill, but the research is showing us that there are significant growth opportunities in software development and IT and research in Chapel Hill. And we're beginning to see some new clusters there that can certainly help us in the future. And of course, healthcare and higher education remain strong economic drivers for our community. So I'm going to stop there and hand the presentation over to Dwight Bassett, the town's Economic Development Director, to give us some additional details on what we've learned thus far and where we are planning to go from here. Dwight?
Thank you. So the chart at the top and the box off to the right gives you some comparison of Chapel Hill to other communities. And if you can click as I talk through these, it will highlight what I'm speaking of. And then you can see Chapel Hill's rating of 1.9% as technology ranks in our workforce. And then on the lower is the per capita university research and development expenditures per 100 residents. And you can see that Chapel Hill ranks pretty high on that. So that's exciting. We just need to work on our technology employment and getting it up to a comparable level. Perhaps we can even look at some of that through some of the research that's occurring. On this slide, unfortunately, it shows our lack of diversity in our economy affects our ranking across the nation. And we have the third least diverse economy nationally compared to our peer cities. And that's certainly something we want to work on as we move forward through this Revive plan. And it's something that we've been thinking about for a lot of years, but making that shift takes much time to successfully achieve it. So some of the targets that came out of our research and work with our advisory group and our consultant EY, that we need to target small businesses with grants and recovery funding. We need to think about retail, tourism, and downtown with restaurants, independent retailers, hotels, and community events and spaces. We need to think about our technology startups, life sciences, software, and IT, and research. We need to think about our corporate office. We've had we went through a decade after the last downturn without having sufficient space for those offices to locate. And through some diligent work with council, we've been able to begin make progress with having that space. And so we need to make sure we're filling it with good professional services. Our housing, making sure it's got a mixed income so that we can attract the kind of workers we want to attract for the kind of businesses that we're targeting. And then talent, graduates and remote workers, really interesting opportunity. It is predicted that 20 to 30% of workers will not return to the office on a daily basis. And given that, we certainly have some opportunity to attract some of that workforce to Chapel Hill to be remote workers, but we also want to make sure we've got a workforce to support any business that wants to locate in Chapel Hill. So there are three key pillars of this Revive framework: resilient economy, resilient place, and resilient people. And we think these are the strategies that will lead to a revived Chapel Hill. And includes things like increasing the creation and success of small businesses, strengthening the ecosystem for innovation startups, and actively recruiting employers and entrepreneurs aligned with UNC and UNC Healthcare. Under place, develop the plans and partnerships to build more accessible and affordable Chapel Hill. Launch programming that showcases Chapel Hill and increases foot traffic in its commercial areas, and builds on our reputation for being open to business and welcoming to all, most importantly. Under people, think about the talent pipeline and what we can do to strengthen that, and then support community partners as they provide social services to address the needs of disadvantaged communities. So a couple of key goals that came out of this planning work, critical actions for us to take in the coming months so that we are sort of geared up and ready for implementing this recovery plan, includes executing on a business retention and expansion initiative to conduct 20 interviews in 45 days in which feedback will inform future implementation and work we need to do to help sustain our businesses and help them expand. Expand our marketing resources to tell the real estate opportunity story in Chapel Hill to support filling vacant and new spaces in the community. Then to create grant programs to support strengthening businesses during the redevelopment like the East Rosemary project, and as a part of a post-pandemic recovery. We want to make sure none of the work that we're doing to grow our community has even more negative impacts on top of the pandemic. So we're looking at ways we can make that happen. And then look at the work of similar economic development agencies in North Carolina and our peer cities and compare the town's output to determine areas for potential growth in programs and services. And this is partially to look at this plan and all the goals in this plan to make sure that if the town's standing it up, we have the resources to successfully stand it up, or either we assign some of those goals to our partner agencies like the Chamber of Commerce or the Downtown Partnership. And that's sort of it in a nutshell. It's a comprehensive report. We'll be posting it on our website, open2.biz, open2.biz/revive. We'll get this posted, the full report posted in the coming days, and you can click as you have time and read more information if you're interested.
I want to thank Dwight for his leadership and Laura on his team. The Revive Plan, y'all, has been an exceptional partnership of really diverse community leaders making a plan for a way forward. We hear from communities across the country who suffered crises, whether it's the Deepwater Horizon destroying the beaches on the Crystal Coast or places that have been destroyed by hurricanes. Setting a plan to recover is an essential step, and we know that recovery is often inequitable, and that we focus to make sure that as we recover, we focus on making sure that all of our businesses and their employees recover well. Manager Jones, I really appreciate you prioritizing this. There are so many other things that demand our time, and for you to prioritize focusing on economic recovery, I really appreciate that. Your leadership here at this time. You're the right guy at the right time, and we appreciate you.
Thank you.
We have a few minutes before we conclude. We're aiming for a conclusion. We just have a couple wrap-up comments to offer, but what questions, Katie, have you seen in the chat? Or do you have questions yourself?
There were no questions in the chat, but the slide, if whoever's driving the slide, yeah, if you could go back to the slide that Dwight had of some of the, I think this one right here, these 4 goals. I think this is something that really people should keep an eye on, and I guess, Dwight, it'd be interesting to know, is there opportunity to continue to inform this, or what are the next steps for making all of this happen?
So we have laid out a spreadsheet, and we'll be talking with our community partners about implementation, and also the council about which of these goals, because the goals are much deeper than what you see here, obviously. And so we'll be looking at how we set forth on an implementation plan, and that'll be our next step as a part of this plan, is making sure that there's a path forward with achieving those goals. And again, we will post all information on that website, open2biz/revive. And so people who want to keep up, you can also sign up for our e-news and get updates as we begin to roll this out.
And Katie, I'd like to also mention Mayor Heminger just posted in the chat and highlighted that Wegmans just opened up this week with 450 new jobs in our community, which is very exciting. We have been laser focused on continuing positive movement when it comes to job creation here in Chapel Hill. Dwight briefly mentioned the East Rosemary Street project, which will include a new parking garage on East Rosemary Street to support additional development of office space. Grubb Properties is planning, they're renovating a 136, 137 East Rosemary and East Franklin right now. They are planning to construct a 200,000 square foot office building, which could bring another 800 jobs into our downtown. So it's very exciting to see these types of projects moving along. And we've discussed in the last couple of weeks just the sheer number of development projects that are coming through the pipeline right now. I think at the last CCES meeting, we highlighted 42 different projects that our planning department is working on, both big and small. And so that's a good sign. That's a good sign that folks feel that investing in Chapel Hill makes a lot of sense right now. And so we're excited about that as we're coming out of the pandemic as well.
Traditionally, Chapel Hill has been late into recessions and first out. The attributes of this community, the university, the hospital, their payroll, the quality of the workforce has meant our recovery has been swifter than most. Making a plan like this one will make it even better. Let me remind everybody how much of this is within our control. You know, international, national things may feel outside of our control, but our choice to mask, our choice to test, our choice to vaccinate, our choice to plan for the future, to take advantage of grant and loan opportunities, to really focus on marketing and strategy right now, that will aid us as we emerge successful on the other side of this.
Well,
Sheriff,
with your permission, Aaron, I'd love to bring it in for a landing.
Sure, thank you.
All right. Well, thank you everyone for joining us today. As mentioned, we'll follow up with an email after today's event, giving you access to the presentations, as well as the video and contact information. I hope you enjoyed today's production. I want to particularly thank all of our special guest speakers and our sponsors who made today possible, including Chapel Hill Media Group, Duke Energy, and Durham Tech. If you have time today at 4:30, tune into 97.9 The Hill, WCHL, to hear Aaron's synopsis of what we discussed, and also check out chapelborough.com for my summary article as well. Next month, we're going to have another forum on March 25th featuring, it's an economic outlook featuring Dr. Michael Walden. We have an economic conditions survey that is out right now, and we will share the results of that survey at that event. If you haven't taken this survey, we hope you will. It helps inform the findings, and we'll include a link to that survey as well in our follow-up email. If you would like to learn more about our chamber or become a member, contact us or go to carolinachamber.org. We'd love to have you. With that, we are adjourned. Thank you.